More than 250,000 Ontarians are living with dementia. That's expected to rise as the population ages. But already, the limits of the types of care available have left some communities looking for answers. Amongst the largest are South Asian communities in the GTA and across southern Ontario. With us now for more, in Waterloo, Ontario, Navjot Gill, a PhD student in the public health program specializing in aging, health, and well-being at the University of Waterloo. In Pickering, Ontario, Josh Suresh, who has helped several family members here in Ontario access dementia care. And in the provincial capital, Dr. Samir Sinha, Director of Geriatrics at Sinai Health and the University Health Network. Welcome, everyone.
Thanks for having us.
Thank you for having us.
So I think a good starting point is sort of defining what culturally appropriate care is. Samir, what exactly is that?
Yeah, when we're hearing this term culturally safe and appropriate care, and it really comes to the essence of making sure we understand who is the person that we're working with. Because while we might even just look the same, we all have different lived experiences. We might have different cultural backgrounds and needs. We may have different experiences of trauma, and understanding who the person is, what experiences they have, understanding their cultural preferences, their dietary preferences. These are all ways in which we can provide what we call cultural safe and appropriate care. Everything from the language we use, the food we serve, the way in which we interact with something, these are all ways in which we express what we call culturally safe and appropriate care.
Navjot, I'm going to get a follow-up on that. What does that exactly look like in a care setting?
So in a care setting, for example, if we take an example of a long-term care home, that would be having recreation services which are culturally appropriate. For example, right now, if we look at the way recreation services are set up, they're mostly like bingo and, reminiscing about old like 30s and 40s, which might not be, which are like embedded in Western culture. So not really specific, as well as, the services in terms of the food that's being provided there, even though there are ethnically specific cultural homes that do cater to individual needs. The wait times are long and they're not that readily available.
Samira, I want to follow up with you. Who exactly determines what is a culturally appropriate care setting?
Well, right now, it really depends on the organizations that may be funded or organize themselves to provide that. So the government of Ontario, for example, or in other jurisdictions don't necessarily determine who can provide this type of care or how they can provide it, but they can certainly enable it. Because, for example, if you're an ethnocultural community and you say, we would like to build a home that's providing care for Italian Canadians or South Asian Canadians, for example, you can provide that privately, you can organize it yourself through donations, or you might be able to receive government funding that helps you to provide services like long-term care services, adult day programs, other things. So it really is kind of a partnership in some ways between members of a community determining what type of care they want to provide, and sometimes the government that will enable the provision of that care. So it can be, so nobody specifically determines that. And that's why you can see a huge variation in the availability and the quality and types of culturally appropriate and safe care that's available across Canada and specifically in Ontario.
Josh, you went through the experience of moving your mother into a long-term care home that wasn't culturally appropriate for her. Can you tell us a little bit more of your experience with that?
Well, in her case, she didn't really have a choice because her condition got worse fairly quickly. So it's more or less like a crisis situation. So from the hospital, they had to find a place because the way they explained to me was a flight risk, meaning she needed to be in an environment where there is access controls, limits the ability to leave. So she ended up being in an Alzheimer's ward. So there's a lot of restrictions, and basically in that situation, she was literally in jail because there was nothing in her background that sort of associated with it. So it was very difficult, particularly in my mom's case or my aunt's case. They go back to their 20s and, even their teenagers, and they try to relate to things that they did then and ate then. Mm-hmm. So the memory seemed to go so far back. And if they can relate that to the current situation, that's where the alienation comes, they get lost, and then that's very depressing to see.
Navjot, I want to follow up on that. How do sociocultural norms in South Asian communities influence how dementia symptoms are perceived, or do they go unrecognized at all?
Yep. So it like the first step starts with just recognizing the symptoms, and research shows that within the South Asian community, there's a barrier within the very first step. So people have difficulty recognizing the symptoms itself. They sometimes think it's a normal part of aging, or even if, so the term dementia itself does not have a word in most South Asian languages. So it's usually associated with memory loss, whereas we know that it extends way beyond that. So just taking the initial steps of recognizing what dementia is, and then religion plays a big role as well. So in some cases, people usually associate that, if someone is living with dementia, they might be developing a deeper connection with God. So they normalize it in that way, or they might be paying for sins from their past. So research has shown that these are the kind of association people sometimes make. And once they do move past recognizing the symptoms, it's usually difficult associating and directing care within the family because there's so many barriers. And for example, filial piety. So within South Asian culture, we usually tend to believe that we want to keep our elders at home and provide care for them at home. So that kind of restricts the conversation around what do we do next if we do have to, get more care and possibly look at placement in a long-term care home.
I want to follow up on that. Do you believe there's a stigma around long-term care homes in South Asian cultures that, perhaps this is maybe the failure of a caregiver of some sort that we resort to a long-term care home of some sort?
Yeah, so there's this belief that the family take cares. Usually, this responsibility does fall on the son if the couple does have a son. So the son and the daughter-in-law are supposed to take care of the elders as they age, and if you look at Asia, South Asia, long-term care homes or nursing homes are usually seen as a last resort where you move your elders if you don't want to take care of them, or there's no one to take care of them. So it's seen very negatively, where it's seen like the son doesn't want to take care of their parents, he doesn't care anymore. That's why they're putting them in there. So that's that negative stigma associated with it.
All right, I want to pull up some data, read you some data. There's a lack of recent data on this subject, of course, but Wellesley Institute report published in September 2020 found that among the 20 long-term care homes in the GTA with the longest median wait times, 12 were ethno-specific or religious homes. If we go back a few more years, in 2017 to 2018, the median wait time in religious, ethnic, or cultural homes was 246 days longer than a mainstream home. And then as of February 2018, there were 627 long-term care homes in Ontario. And we go back 2 years in 2016, just 56 had ethno-specific designation. Josh, I'm reading out these numbers to you. Does this data reflect your experience? I know that your mother, it was sort of an emergency situation, but even sort of the idea of looking for something that would be specific, culturally appropriate for her, seems like it would have been nearly impossible to find.
Exactly, because they give you choices. Your top choices will have the longest wait time. So, for example, the one we wanted had a 3-year wait time. And so we were hoping to get that. And then the other issue is, if you don't get your top choice, and they more or less tell you to take second or third, if you don't take those, you go back to the queue. That's how it was explained. So it's pretty stressful. So, and in a situation like this, you tend to look for private homes where you have more flexibility. You're able to cater the care in accordance to the patient or the settings. Like, for example, I'm Tamil, my mother is Tamil, so we had a lady who runs a small nursing home, and she was able to, it's like, even when you say generalizing South Asian, but even within South Asian, there's so many different cultural, like food items and things like that. So it was more important for her to identify what she ate for breakfast or lunch, so she could relate to those things and she could look forward to eating those things. But when you, like, someone from Kerala, for example, may not like food from Tamil Nadu. And same thing, so that kind of stuff is also important. So it's for seniors, it little things matter because they already losing their memories and they're not really interacting with the family as much. So what they identify really makes a difference. The reason I'm saying it's not just a wait time, it's even this the larger organizations with cultural focus, they also don't necessarily address the underlying issues of patients connecting with things. So we could say I have a South Asian focus, but South Asians, there are millions of South Asians out there.
Mm-hmm.
So how do you, so I think this niche approach where we are a multicultural society, we have lots of qualified professionals from different communities. We need to figure out a way to connect these guys and figure out a system that works for as much as possible, you know, various communities. Like you can't, like you mentioned, Italian community, for example, even with Italian communities, so many differences. So that's why the caregivers from various cultures, if they come forward and provide a setting that's more customized, if that's possible, I think makes a difference for them. And it's not just a wait time issue.
Samir, I want to come to you in regards to access. Do families and seniors living outside of the GTHA or other major cities have a more difficult time accessing culturally appropriate care, or those who live in major cities? It seems, Josh had mentioned 3 years potentially to get for care home for his mom. What do you say? What do you see there?
Yeah, no, I mean, generally, our more diverse communities tend to live in more urban areas. For example, you have some exceptions. For example, one of the best Finnish-focused nursing homes in Ontario is actually in Sudbury, called Finlandia Village, for example. So, so it really it's really kind of hit or miss around all of Ontario. But access is an issue. But even in urban areas like Toronto, for example, we have some great homes for certain communities, but we have other communities that have no specific homes focused on them, such as our growing Somali community or our Afghani community, for example. And I think one thing that, Josh said that was really important was that, you could try and say, okay, let's build a home for every community, but not everybody not all of my patients necessarily want to go and hang out just with other South Asians or other Italians. They actually, one of the things they like about Canada is that we're a diverse, community. And I think really the essence here is we can't solve this by building specific homes for specific communities. I think we need to have a variety, but at the fundamental essence of this, we need to ask who this person is. And if we understand that this person, for example, is from this part of South Asian society, and this is the type of food they like, and these are the experiences they grew up with, this is the music they like, how do we actually make sure that we have an individualized care plan? And as I'm working on developing the new national long-term care standards for Canada, we're really focused on this. It's not about thinking about a home or a community, it's actually focusing on that resident and their family and their needs, for example, and then understanding how do we actually create an individualized plan that sees them, that recognizes their needs, and really caters to their preferences, their needs, and values. And that ultimately is what high quality long-term care looks like, and what we really should be focused on providing.
Now, Joe, I want to come to you in terms of navigating the healthcare system. That you had mentioned, there are challenges there. What barriers do South Asian people face when they navigate the healthcare system in order to receive a diagnosis?
The first initial barrier is definitely the language. So from my own personal experiences, my grandmother is living with dementia. So even though her family physician does speak Punjabi, it is very easy to go and we sometimes don't have to worry about coming along with her initially. Now that her dementia has progressed, somebody needs to be present with her during appointments. As per specialists, the wait time is already long, and adding a request for translator on top of that sometimes does create a longer wait time. And aside from this, just coordinating the care amongst the family, especially as when the family members act as translators. I might not be available every time to go with her, or my mom might not be available every time. And then when we're triangulating this care, a lot of it gets lost in the communication. So I guess language barrier is one of the biggest issues that we have while navigating the systems, even though yes, there are a lot of doctors who are more than accommodating and translators are available. But in the long run, just trying to communicate and coordinate it is a big issue.
Samir, I'm hoping you can give us a snapshot of sort of the service gaps that exist today. In specific, I want to talk about programming, social and sort of recreational programming, which some of the panelists have mentioned already. But what service gaps exist today?
There are a ton of service gaps that unfortunately exist. So I helped to develop the previous government's dementia strategy that really tried to comprehensively address these issues. Unfortunately, our current government did not continue implementing that plan or the investments we had that really recognized that the first part is that there is a lack of public awareness, not just in South Asian cultures, but across most of Ontarians understanding what dementia is, how to recognize it, because that's really where we start that important idea of understanding that and getting towards a diagnosis. Because when we get with and then part of the challenge is that we don't require any medical trainee in Ontario. None of the medical schools in Ontario, unfortunately, make geriatrics a mandatory part of the training, and that's an important way in which we can make sure that future doctors and current doctors understand how to diagnose and manage dementia. So access to even just a diagnosis is quite limited. And then even if you do get someone who is able to diagnose you and understand what the issues are, then it's actually linking them to the appropriate services, the caregiver supports that could be important, the what we call adult day programs, very specific community programs that might exist, for example, that can help individuals living with dementia and their families get the support that they need so that they can approach these issues proactively. Because the challenge is that with dementia, we don't have anything that's curative. We don't have any treatments that are disease modifying. So the best thing we can do to help people with dementia stay active and engaged members of their community is by supporting them with education, with resources, and making sure that they understand what they might be able to access. But what you may be able to access varies quite significantly across the province, especially when really there are just differences in what's funded, what's organized. We don't currently have a specific coordinated approach to supporting people living with dementia and their families across Ontario, and I think we really need to get there.
Navjot, do you think some caregivers hold off putting their loved ones who are battling dementia in long-term care homes due to the lack of sort of the options out there?
Yes, speaking at least from my personal experience, that's one of the reasons why we have held off with our grandmother. We have, along with the cultural connotations around it, that this is not the right thing. She should be staying at home with family. We live in an intergenerational home, so her son, my dad is there, we are there. But looking, like out of curiosity, just looking at services, I'm afraid that if she goes to a long-term care, just like Dr. Sinha mentioned, that having that person-centered care might be difficult, especially in her case, because she might not associate with the food there, the services there, and just like how Josh was mentioning as well, the wait times are very long. So I guess these are some factors that add up to just holding off placements into long-term care, at least from my own personal experiences.
Josh, I want to talk to you about your experiences as well. At what point did you realize you could no longer care for your mother at home?
It's not just dementia. Like when they have dementia, there are other complications comes. Like with my mother's issue was she was hearing voices, and voices are instructing her to do certain things. So like leave the home. It's like in my case particularly, she started talking to my dad who passed away many years ago. So, oh, he's waiting outside. He wants me to come. So she would walk out in the middle of the night and in a dead of winter. So if we don't catch her, then it'd be a problem. We try to put some locks and things like that, but that I was told you can't do that. So really, it became a question of her safety And then really we couldn't provide 24-hour care. So that's when the decision was made. And that was the crisis situation. The police actually told us, like I have some friends, they said, look, you can't keep her like this. And then he actually suggested I put her in a hospital, and from there she went to the home.
Now, Josh, you've helped several families in Ontario access dementia care. I'm curious, where are you sending family and friends and telling them to go in terms of resources, information, and long-term care homes?
Like it's really research. Like I have a sister, she's a nurse, and my spouse, she's also a nurse. So we find things, and you also research within the communities. There are people who's been in this industry long enough, and they know what to do, but they don't have the resources to do it. I mean, you kind of figure out a way to network things, and it's really through network, because everyone can advertise what they do, but in reality, what happens is it's a different thing. So you just have to rely on your network to really understand the care that advertised is being provided. So that's the trick.
I want to read a statement from the Ministry of Long-Term Care. The agenda reached out to the ministry about their efforts to expand culturally appropriate dementia care. This is the response that we received Wednesday afternoon. While individual homes may choose to provide culturally specific services and self-identify to their respective home and community care support services as serving cultural, religious, or linguistically diverse residents, this information is not tracked at the provincial level. The ministry also detailed its not-for-profit loan guarantee program, which unlocks $388 million in lending from Infrastructure Ontario for these homes. Samir, most of the decision-making, as we know, comes from the provincial level with the Ministry of Long-Term Care. Is the ministry doing enough to support the creation of ethnocultural homes or beds dedicated to diverse care?
Well, the key is, what we just heard, was the fact that we don't even have a system for people to get access to diagnosis and support to navigate things in the community. When we're hearing that the way you access care is when the police tell you this is no longer viable, go to a hospital, crisis, now you're in a crisis situation, you're now being forced to put your mom or dad into a home that you don't want them to necessarily be in. That's our current system that our government has actually created. And this is what I live with every day with my patients and the families that I have to navigate this through. Luckily, I'm pretty expert at navigating through, but there's only so many geriatricians. There's only, 180 of us in Ontario. And this is just not a system. So when the government says, we're helping to provide more beds and this is what we're doing, the key is we need to actually have a community-based system, because we know that 1 in 3 people living currently in our long-term care beds doesn't necessarily need to be there. They could actually be supported with better existing community supports if we would actually provide them. But right now, our government is hell-bent on spending $4 to $6 billion on building 30,000 new beds, when you could spend far less to actually provide better supports to people, keep people in their own homes. So, is the government doing enough? Well, they're doing a lot to build beds, but as you heard, they're not tracking what's ethnocultural. They're not necessarily supporting the provision of more adequately funded care to actually make sure that we can get resident-centered care in every single home. And so really, it breaks my heart when I hear the stories that we've just been hearing about how people are using their own networks to try and navigate things because they can't rely on a government and a current system that actually functions well for them to get the diagnosis, the supports they need. And the only way you get into long-term care, it seems, is in a crisis. And that's really the last way that people should be accessing this, because the stress on residents, on their families, is nothing short of enormous.
Josh, I'm going to come to you for our last question here. Do you think that if your mom had received the right care, she would have lived longer and had a better quality of life?
Obviously, it's not living long. The most important thing is how she lived. So in that setting, like, she would see me maybe 3 times a week for half an hour. And then I actually managed to find someone. She was a PSW who could speak the language. So she would go in during lunchtime, because the bigger issue was she refused to eat, and she, like, from 120 pounds, she went down to like 80 pounds because she wasn't eating. The staff there, they will not force her. So this person can go and talk to her in her own language, talk about, things that they used to do, and during the conversation, she spoon feeds her, and that's what made the difference. So maybe simpler choice maybe is to find staffing more appropriate for the patient population, because where my mom was, it wasn't. They had to follow. It's a large corporation, so they have to follow certain guidelines. It's very difficult for them to sort of cater things. But if you can have people or staff who can speak the language, maybe it's a little bit easier, or understand the culture. It makes the quality of life better, because my mom, she wasn't talking too much. She would say things like, "What a life, Suresh," you know. She didn't want to live. That's not the way to end, towards the end of your life. It's very hard to, for a relative as a son, to see your parent just in that situation. She was thinking she was better off dead.
Josh, thank you so much for sharing your story with us tonight. Samir, Navjot, thank you as well for sharing your expertise on this topic. Really important story.
Thank you.
Thank you.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.